All right, I'm gonna hit you with the last three. These are 10 additional and final pain points and things that you might wanna address with the surgery team if you're gonna be a post-surgical caregiver. Let's go ahead and get started once again. Let's roll with it. Let's go. Sleep positioning. So some surgeries require specific positions in order for the patient to heal properly. Ask what position the patient should sleep in and for how long. Yeah, I'm going to ask. Resuming sexual activity. So it's so important because many couples are unsure when intimacy is safe again. So ask when it's appropriate and what precautions to consider. Financial insurance or questions, very important because post-surgery care, equipment, and medicine can be costly. So ask about expected costs, insurance coverage, and what financial aid or billing support is available. You know, a lot of hospitals for major surgeries have grants that they have accessible to people who may not have the proper or complete insurance coverage. So make sure that you ask about that. Duration of recovery. So important because unrealistic expectations can cause frustration or overexertion. Ask for a realistic timeline with milestones for recovery. Managing house responsibility. So caregivers are often responsible for the patient's household as well. Ask if any in-home help is available or recommended for housework or errands. Communication barriers. So it's so important because hearing loss, speech issues, or language differences can hinder recovery. Ask if translators, hearing aids, or communication tools will be needed for them to recover. There is always something serious to consider, post-op depression. Now that's so important because that trauma from the surgery can trigger emotional trauma or depression. So ask what symptoms to look for and request a mental health referral if they need it. Setting realistic goals, so important because patients often expect to bounce back faster than what's possible. Ask the surgeon or recovery team to provide clear, short, and long-term goals so that we all understand. Changing dressing safely. Improper technique can reopen the wound or cause infection. So request hands-on training or a nurse to demonstrate before the person is discharged how to change those dressings and keep them clean. Now, this one's for you as a caregiver, coping with caregiver stress. Burnout leads to mistakes and emotional strain. Ask about support groups, respite care referrals, or counseling resources for you as a caregiver. So these highlight most of the things that you would want to consider when you become a post-surgical caregiver or you're informed that you're going to be providing caregiving services to someone post-surgery. But it doesn't involve everything. I'm sure there's more that we didn't even touch on. So it's so important for you to ask those questions with the surgical team and if possible, have the person there so that they are also aware of what you're going to be handling as you also help them to recuperate. And if possible, make sure you don't do this alone. Develop a support system with people who can help you so that you can continue to provide the care recipient what they need as well as get a break yourself. Don't forget to go to HansonCaregivingConsultingServices.com for more information. And until next time, this is your girl, Essie. I'm totally out.